Hello, friends. Welcome to episode 22 of Conscious Caregiver Conversations. I am going to be solo today. This was my first week back on the unit, and I worked Monday, Tuesday, and Wednesday. And Sam has some weird things going on with her schedule too. So the times are just a little wacky right now. So bear with us as we get into a new flow and kind of try to figure out what's going to work best for these episodes. But I wanted to jump in here while some of my thoughts were flowing and fresh. I'm actually getting ready to head to the beach for a few hours to get some vitamin C after my first week back on the unit. And if you saw my previous post on IG that I shared prior to this episode, there were a lot of recurring themes that came up, and I just think that they are so relevant to how so many of us are feeling when we're working on the unit, particularly if we're just starting a new job or we're in a new role or we're learning something new. And all of these expectations and pressures that we place on ourselves that really contribute to a massive amount of energy being spent in the wrong places. And when that energy, when we are giving and giving and giving of this energy and it's being spent in the wrong places, that 1,000% contributes to burnout. So it's such an important topic of conversation. So this past week, I had my first 3 shifts back on a cardiovascular ICU, which is a good majority of my experience clinically. I also worked in the emergency department, but I really love taking care of heart patients. However, I noticed that there were a lot of these themes of I should be able to do more. I should be able to get back in my flow quicker. I should remember how to do A, B, C, and D. I should be able to take care of this patient more independently. Yada, yada, yada. Like all of these themes of shoulding on myself about where I should be in my practice because this is the type of care that I gave for so many years, right? But when I sit and I reflect on my career and the amount of time that it's been, so my last time working on a CVICU was 3.5 years ago. Prior to that, if I'm being truly honest with myself, it was about 5.5 to 6 years ago when I was working in CVICU in South Carolina, where I got most of my training and was super comfortable with the unit, super comfortable with the surgeons and how they did things, and really had a flow for caring for my patients. I knew where everything was, right? I knew where the lab was. I knew where the blood bank was. I knew where the pharmacy was. I knew what the processes and procedures and protocols on that unit were, which granted, for cardiothoracic surgery, the pathways are very similar, but you still, like different facilities, different units have like their nuances and their little details and things like that. So it's been a while is really what I'm getting at. But yet I found myself this week really putting a lot of pressure on myself to be something that I'm simply not right now. Like I really wasn't being fair to myself, truly. It's been 3.5 years since I've been clinical. Yes, I was a critical care educator 3 years ago and then got promoted into a leadership position. And for the last 2.5 years, my role has been very administrative. I've been going to meetings. I've been sitting at desks. Yes, I've been talking about things related to critical care and how they should be done, but talking and doing and dealing with the intricate details of what happens with a patient have not been a part of my practice for the last 2.5 years. And I'm very much a high achiever. I have a lot of perfectionist tendencies. I think that's very common in critical care, because if things aren't being done just right, there can be big shifts and changes that happen that produce poorer outcomes for the patients. So it's super important that we're on top of what we do, that we're knowing, what we're doing, and that we're not making changes or doing interventions that, are not great for our patients. But it's just interesting because if you're like me, which I think so many critical care nurses especially, but nurses in general are, it's this whole idea of perfectionism. I'm not good enough. I don't know this. I should know this. I don't remember how to do this. I should remember how to do this. But when I really look back on the last 3 days, by day 3 of being back on the unit, I was essentially taking care of a post-op day 2 cardiothoracic surgery patient on my own. Yes, I had my preceptor, and certainly I asked her questions or others questions when I needed to, but I pretty much did everything from top to bottom on this patient myself. 3 days after being away from the bedside for 2.5+ years. When you really look at that, that's pretty damn good. And if you don't agree with me, go watch another video because that's pretty damn good. We've got to stop placing these unrealistic expectations on ourselves and others, and we need to remain open and heart-centered. That may have just kicked out for a second because of a phone call, which I'm really ticked about. Anyway, we have to stop putting all of these unrealistic pressures on ourselves, unrealistic expectations, and we have to stop doing it to others too, quite frankly. We need to remain heart-centered. We need to keep our hearts open. We can't be afraid to ask questions. We can't criticize others who ask questions, even if in our minds we think they're stupid, because when it comes to patients and providing quality care and delivering positive outcomes, there are no stupid questions. Please ask questions. Please never think that you are stupid or not worthy or not a good nurse or whatever it might be because you asked a question. I don't care how dumb the question is. Ask the freaking question. That is something that I'm having to honestly be okay with in myself. And I do ask the questions. I've been humbled in my career, you guys. Humbled. I have gone into clinical situations thinking that I know it all, that I am all that in a bag of chips. And guess what? I got my ass handed to me. I am humble AF at this point in my career. We all need to be. We all need to be because we don't know jack. We truly, I don't care how long you've been doing this, patients are going to do things that are going to throw curveballs. 5, 10, 15, 20 years into your career. Patients are going to do something and you're going to be like, holy crap, I've never seen that before. So I come on here today to say that number one, we have a tendency to think that we need to show up perfect, to think that we should know it all. We should on ourselves constantly. I should be able to do this by now. I should be able to do that by now. Why am I not doing this quicker? Why am I not doing that more accurately? Why didn't I think of that? We have to stop doing that. We need to give ourselves more grace. I constantly strive to show up as the best nurse that I can be, but also super, super, super humble, knowing that I'm going to have questions, that I'm not going to know everything, that things are going to happen that throw curveballs in my path, and just be willing to learn, keep an open heart, keep an open mind, but also take some time to reflect on where those perfectionist tendencies come from. Where do those feelings of not good enough or unworthiness come from? Where do those feelings of, I should be here now, I should be doing this now, I should be showing up this way now? Where does that come from? Because there's underlying wounds, there's underlying programs, there's underlying constructs that we have created that need to be looked at and addressed. They need to be healed. So on one hand, we need to look at ourselves and reflect and be like, okay, I'm right where I should be in this moment. I'm doing exactly what I need to be doing in this moment. But then there's also needing to look back and see, but why am I feeling this way? What happened when I was a little girl? What happened when I was a young adult? What happened ancestrally? Whatever it might be. Like, what happened that created these emotions and these feelings and these ideas of this is where I need to be, or this is how I need to be showing up? Because as I said in my post, your best is always going to be good enough. The way you show up is always going to be good enough for the right people, places, and circumstances. So there's nothing going on around you per se that necessarily needs to change. Yes, conscious caregivers, I am telling you this. There's nothing going on around you per se that needs to change, because everything that's going on in your environment is pointing you to something within yourself that you need to look at more closely. So what happened earlier in life that causes you now to say, I need to be this perfectionist, I need to show up a certain way, I need to be A, B, C, or D, and I should be doing this by now, I should be doing that by now, I should be showing up this way by now. That's all stuff that has happened throughout your lifetime that has caused you to perceive what's going on around you a certain way. And it needs to be looked at so that you can feel to heal. So that you can go back to that place of when what you did wasn't good enough, or you didn't do it perfectly and this happened. That needs to be looked at. That needs to be felt so that you can heal it. So that you can show up today knowing that your best is good enough. So that's all I have for you this week. I hope this helped some of you. Please engage. Please let me know. Please tell me if there's something you would like us to talk about. But I just really felt called on this whole topic of unworthiness and perfectionism and the way that we spend our energy in places that don't serve us, because that contributes to burnout. We have to stop wasting our energy on these places and spaces that drain us, because that contributes to burnout. All right, y'all. Have a great week.